This is the Baker Act Guardian Advocate Training, Module 4. In this module, the topic we will discuss is mental illness. There are two parts. Part 1, A and B, focuses on diagnosis, and Part 2 on psychotropic medications. There will be one comprehensive knowledge review at the end of Part 2.
I never thought I'd ever say that I have mental illness. Never in my life. Maybe thought it happened to those people, whoever those people were. Come to find out, I'm one of those people.
To be effective in your role, you need to understand and have empathy for the individuals that you serve. Mental illnesses are conditions involving emotions, behaviors, or thoughts. To be diagnosed with a mental disorder, the condition must produce significant distress for the person experiencing the condition and must interfere with the individual's ability to function at work, at home, or in relationship with others. This is Part 1A of Module 4. In this section, I'll focus on the diagnosis of mental illness, psychiatric diagnostic process, and schizophrenia. The word diagnosis originates from a Greek name that means to learn or knowledge. Defined, a medical condition or disease is identified by a medical professional based on signs, symptoms, or diagnostic procedure. A psychiatric diagnosis is based on the symptoms exhibited and responses provided by an individual when interviewed by a psychiatrist. Information in the person's medical history is also taken into consideration. The diagnosis creates a framework for the person's treatment. The psychiatric diagnostic process includes identifying current symptoms that are causing the individual significant distress, reviewing the person's biological, psychological, and social history. The information may come from that person, the family, or other treatment facilities. They should also rule out non-psychiatric reasons for the symptoms. A complete physical exam with the proper lab tests is very important. Physical illnesses can produce symptoms that resemble mental illness. Some medications or street drugs can also produce such symptoms. When the guardian advocate has reviewed the individual's psychiatric clinical record, then they may see several different diagnoses listed. Each diagnosis provides information to help the clinicians plan their proper treatment. After a preliminary diagnosis is made, then treatment can begin if the guardian advocate provides express and informed consent. The process of arriving at a final diagnosis can take time. A person's diagnosis may change over time as their condition changes or a new professional evaluation is completed. Prior to providing consent, the guardian advocate needs to review the clinical assessment and proposed treatment plan, speak to the attending psychiatrist about the individual's condition and treatment, and speak to the individual being held in the mental health facility to discuss the proposed treatment plan. Upon an individual's admission to a mental health receiving facility, the psychiatric team gathers information necessary to formulate a psychiatric diagnosis, including the person's psychiatric history. They conduct medical, psychological, and social assessments to determine the individual's past and present conditions and challenges. They determine whether the individual is competent to voluntarily consent to treatment, and if not, who is legally authorized to consent on their behalf. By law, the receiving facility must complete the treatment plan within 5 days after the person is admitted under the Baker Act. Team members who commonly contribute to the plan include the psychiatrists, nurses, social workers, psychologists, and occupational therapists. In reality, nearly every receiving facility prepares a preliminary treatment plan within 24 hours of a person's arrival, subject to later completion. Generally, JCAHO and federal standards require a treatment plan much sooner than that required by the Baker Act. The Joint Commission on the Accreditation of Healthcare Organizations, JCAHO, sets standards for healthcare organizations and issues accreditation to organizations that meet those standards. The treatment plan, including clear goals and measurable objectives, must address the specific factors that triggered the psychiatric crisis and the Baker Act admission. If possible, the individual should be allowed to participate in preparing the plan and reviewing it prior to implementation. When a person refuses or is unable to participate in such planning, this fact should be documented in the clinical record. The guardian advocate should be included in the treatment planning process and is legally authorized to view all clinical records. The facility must obtain that express and informed consent from the guardian advocate for the individual held at a mental health treatment facility before proceeding with treatment. Discharge planning begins upon admission to the Baker Act facility. Caseworkers and other staff begin making arrangements to ensure the individual has adequate housing, resources, psychological support, all those requirements upon discharge. As guardian advocate, review the goals and objectives which serve as the markers of progress towards the individual's recovery and discharge. Identify which facility staff will provide the treatment services and be aware of the challenges to treatment success. Be familiar with the person's medications. Recognize that discharge planning begins early in the treatment process, and be aware that treatment plans may need to be modified based on future developments. Meet with the individual that's admitted to the Baker Act treatment facility regularly. Healthcare professionals document the care delivered and the individual's progress and clinical status over the course of a hospitalization. In addition to allowing treatment team members to communicate with each other, progress notes allow the guardian advocate to review the case details. Facility staff regularly meet to review the person's current status, treatment progress, and the future plans. If possible and appropriate, the individual and their guardian advocate should be included in such meetings to provide their input. While held in a mental health facility, an individual's treatment plan may include psychotherapy. It's also known as talk therapy, counseling, or simple therapy. This treatment involves discussing what feelings, thoughts, and behaviors are causing a person severe emotional distress and how they may cope better in the future. There are many different types of psychotherapy. Cognitive behavioral therapy, or CBT, is one of the most effective treatment options for anxiety disorder. Using CBT, individuals learn to recognize and change thinking patterns that generate fears. They also learn healthy new ways of behaving when they do experience an anxiety attack. For example, someone who maybe recently had a panic attack in a grocery store may now avoid grocery shopping altogether. This fear could dramatically affect their life, particularly if they have no one else to go shopping for them. CBT can help teach what triggered the initial panic attack and how to lessen the likelihood of future attacks and the intensity of another attack that does occur. Major psychiatric conditions or categories of mental illness include schizophrenia or psychotic disorders, mood disorders, anxiety disorders, personality disorders, cognitive disorders, and substance-related disorders. I will highlight the ones that are identified through the statewide public guardian office. This module is not a diagnostic manual. It's only an overview of some of the mental illnesses that you're most likely to encounter. For more information and complete information on other disorders, refer to the Diagnostic and Statistical Manual of Mental Disorders 5, also known as the DSM-5. It was published in May of 2013. The DSM-5 contains a more extensive discussion of these categories as well as numerous other classifications of disorders. The DSM-5 provides a systematic description of the essential features of the disorder, associated features, and other information that you might be interested in. You can access this information online at www.dsm5.org. For many people, schizophrenia is the illness that most commonly comes to mind when they think of mental illness. Schizophrenia is one of the psychotic disorders, and broadly speaking, psychosis means being out of touch with reality. Schizophrenia lasts 6 months or longer, usually much longer, and often seriously affects a person's ability to work or to care for themselves. Approximately 1% of the adult population is affected by schizophrenia. The 5 symptoms of psychosis are delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. Individuals that are diagnosed with schizophrenia exhibit one or more of these symptoms. The person must have been experiencing some change in behavior for at least 6 months or more, and this change may be gradual or sudden. For at least 1 month during this time, the person must show 2 or more symptoms of psychosis.
I get to the point where I don't want to live anymore because the mental process of the mind takes over. When I think I'm doing good for a while, something mental takes over, and it scares me. Years ago, I didn't do that. Years ago, I didn't have to worry about that one thing. I was one less paranoid. I mean, one less crazy. I was one less crazy. I mean, years ago, I didn't have this new mental problem. I don't know what it is. I don't know what it is, but it's pretty scary. That's why I called the police. Nobody else was doing it. Boy, those people at 7-Eleven, they're always on the phone talking about me. Always. Especially in the summertime, nice weather. They're always talking about me, calling hospitals, Barnes, St. John's. There's a lot of doctors at not 7-Eleven, Quick Trip. You know what Quick Trip is? There's always a lot of doctors and nurses going there making point like kill her or do something to her.
Do you notice changes in your attention, with your illness?
Huh?
Do you notice changes in attention with your illness?
I'm retarded.
But do you notice having problems focusing attention or keeping your attention on things?
Yeah.
Tell me about that.
I don't know. What was that again?
When's the last time you felt good?
I don't remember. It's killing me. It's keeping me from having a boyfriend, keeping me from driving. It's killing me. Like in China or somewhere. I just believe if somebody's been suffering years ago, they should take an OD and die, because psychologically they may not want to take the OD, but to get out of their misery, they might. They fight it every night. And every day he's always fighting with me. Michael's always fighting with me. Drop dead, geek, retarded bitch. Oh, that stuff doesn't mean shit to me anymore. I'm so used to it.
Hearing
I do have a brain problem. But I don't have a brain tumor.
The woman in the previous video was having a psychotic episode. Her behavior demonstrated several symptoms of schizophrenia. Let me review these symptoms in detail, beginning with delusions. Delusions are false beliefs that an individual maintains in spite of compelling evidence to the contrary that cannot be explained by a person's culture. Some examples of types of delusions include delusions of grandeur, and this is perhaps the most famous of the delusions. Examples include a person believing that they are the President of the United States or God. Somatic delusions, these are beliefs that someone has a horrible sickness such as cancer with no supporting medical evidence, and this delusion is often bizarre and contrary to the medical evidence that does not change the person's mind. There are delusions of persecution, where someone believes that they're being plotted against, threatened, or mistreated by others. And there's delusion of reference, the belief that other people are talking about them, such as portraying their life in movies or television. The individual in the following video clearly is experiencing delusions. Can you identify which types?
Intervention Center and talked to them on the phone. They said there was nothing they could do for me for one night, so I wound up here by ambulance. Paid an ambulance to take me here.
Okay.
Because the crisis intervention couldn't do anything for me.
Have you ever made any suicide attempts?
Oh yeah, I have. A couple of them when I was 19.
Okay. Are you usually able to ask for help when you start feeling like that?
No, I was never able to ask for help before.
Okay, so this is a new thing.
This is a
You're
new
coming
thing
into
for
the
me.
hospital.
Yeah,
Okay.
the way I came in here is unlike any other way I've ever come into a hospital. Asking people to please help me so I do not kill myself.
That's all the questions I have for right now.
Can I go back in now? Yeah, I'm getting very uncomfortable out here. I think somebody might be trying to shoot me. Somebody might be trying to kill me.
If someone's experiencing a delusion, do not discount their experience. Listen for what may be real. Avoid a debate or an argument about the delusion. This will only increase tension in a situation. And let that individual know that you will listen and that you will attend to their concerns. Hallucinations are false sensory perceptions. It is a perception of seeing, hearing, feeling, smelling, or tasting something that other people do not experience and that really has no real-world stimulus to cause it. Auditory hallucinations, hearing things that are not there, are by far the most common type of hallucination in schizophrenia. A person may hear voices telling him or her to do something called command hallucinations, or commenting on his or her behavior or personal worth. Visual hallucinations occur in about 10 to 20% of the cases, and hallucinations involving other senses such as smell, taste, or touch are rare in schizophrenia.
Which is that sometimes you're aware of someone or something speaking to you. Does that still happen?
Lots.
It happens a lot? Okay. Tell me about that and what you notice.
There are people talking about the people I've been telling you about.
Right. And what sort of things do they say?
They say that I don't keep my house clean. And that's why I haven't got any friends.
Right.
That they don't like me.
But they're quite unpleasant things that are being said to you. Or are they said to you or are they said about you?
More about me.
So from that, do I understand that the voices talk to one another? Right. Are they male or female?
Male. Men.
And where do the voices appear to come from?
Different places around me.
So,
Usually where I can't see.
somewhere outside in the room where you're not able to see anybody? Okay. Okay. Do they stop you from doing anything?
If they tell me not to go out, I don't go out.
Okay. Do they ever tell you to do anything else that you wouldn't normally do or that you feel you shouldn't do?
No. No, they don't tell me much, no.
Okay. Do you hear any other types of voices in addition to these male voices that talk to you and about you? Are there any other voices that you hear at any time? What are they, or what's that one like?
That's different. That's quite a nice person.
Okay. And does it, apart from saying nicer things, is it any different in its character to the other voices that you hear?
It's a lady.
Right. So very distinct from the other voices. And whereabouts does that voice seem to come from? Is that from outside, around you in the room?
It's in my head.
Right.
Near it in my head.
And every time you hear that voice, does it seem to be coming from within your own head?
Yeah.
You said that it says nicer things. Could you give me an example?
It tells me that I'm all right.
Mm-hmm.
And that I shouldn't always listen to what the others are saying.
Right. Do you find that comforting or reassuring? Okay.
As noted, hallucinations are disturbances of perception such as vision, hearing, smell, taste, and touch. Hearing voices is the most common hallucination. Ask for help from the case manager about how to best deal with and communicate with an individual who is having hallucinations. Inform the case manager if this is a new symptom, and remember that not all people who experience delusions and or hallucinations have schizophrenia, nor do all persons with schizophrenia experience these symptoms. Disorganized speech is another symptom of a schizophrenia or psychotic disorder. The disorganized speech may include the use of made-up words, inappropriate use of rhyming or repetition of phrases, frequent tangents, or communicating in other incoherent ways. The person is usually not aware that his or her speech is not understandable since it makes sense to them. The next video gives you an idea of what a person who is experiencing disorganized speech looks and sounds like.
What went on that you ended up coming into the hospital?
Well, Jesus was giving me all these window crack and screen crack sounds, telling me that they was going to break into the house. So I put the camera stereo in the room where they chiseled the window out to come through the window. And the camera stereo, the security guards picked that up, the message, by putting that camera in that room.
Were you in danger?
Well, if anyone gets into the house, they said I get shot.
Who said?
That's the eagle.
Can you say a little something about the eagle?
Well, the eagle works through General Motors. They have something to do with my General Motors check I get every month. The 5, you go right left to 7 number on the clock is the fire number. You go right left to that number. That's what the 25 is. If you don't do something they tell you to do, and Jesus makes the shotgun sound, and then the phone rang, not to answer the phone or the doorbell.
Why not?
Because you get shot.
Who would do the shooting?
The eagle.
I went and bought notebook paper, and I wrote down the time and what I heard in a sentence.
Mm-hmm.
So that Jesus kept answering my messages. My son does the grocery shopping,
Mm-hmm.
and if he doesn't do the grocery shopping, the house goes to me and my granddaughter.
Mm-hmm. So that's really a requirement for him.
Yes.
That he does that.
Doing the 25 of the clock.
Okay. Well, he has to stick to that timing too?
Well, he's the before,
Mm-hmm.
but he believes in Jesus also.
Mm-hmm.
And he told me, he said, Mom, I don't want to go there. And I said, well, I'll try to help you out.
Go where?
Go left.
Disorganized symptoms or behaviors may include difficulties when carrying out activities of daily living. For example, they may appear disheveled or may have difficulties taking care of their living quarters. They may dress in an odd manner, or they may evidence bizarre behaviors such as odd movements, gestures, or postures. They may also display prolonged silence, silly giggling, or repetitive meaningless motions. The next video will give you a good example of these kinds of behaviors. Also note that there are two exceptions to the requirement of having at least two of the symptoms described. First, only one symptom is required if the delusions are bizarre or highly unlikely to occur. For example, being controlled by a computer chip implanted by aliens, or the target of lightning striking. Second, only one symptom is required if the hallucinations involve two or more voices conversing, or a voice keeping a commentary on the person's behavior or thoughts.
I'm doing so hot, I think, and feel as though people have called me here to electrocute me, judge me, put me in jail, or kill me, electrocute me because of some of the sins I've been in.
The symptoms that I just described, delusions, hallucinations, disorganized speech, and disorganized or catatonic behavior, are called positive symptoms because when they occur, they suggest the presence of the disorder. Some other symptoms of schizophrenia are called negative symptoms. They are symptoms that consist of a lack of a certain desirable behavior. For example, people with schizophrenia may avoid social contact. They may display very little emotion, their speech may be very limited, or they may show very limited or little initiative. They also may neglect their personal hygiene.
At this point, what would you like us to do for you?
I'd like you to get me off of cigarettes, get me dried out, cleaned up, so I can go home and get a job in a bakery and go to medical school.
To review, symptoms of schizophrenia or psychotic disorders include delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. Schizophrenia usually first shows up in adolescence or early adulthood for males and in the late 20s for females. It usually starts with a gradual decline in functioning, and this decline may include symptoms such as social awkwardness, shyness, peculiar behavior, lack of initiative, or difficulty in work or school. Eventually, the person experiences a psychotic episode in which the person meets the full diagnostic criteria for schizophrenia. Often, the symptoms of schizophrenia will come and go over the course of a person's lifetime. The episodes of psychosis may be separated by prolonged periods with fewer symptoms, and over time, a third of people with schizophrenia will get better, and they may be able to return to a relatively normal level of functioning. However, for another third of these persons with schizophrenia, their symptoms will get more and more severe over time, and their lives will be very severely disrupted. The rest will continue to experience symptoms of schizophrenia, but their symptoms will stay about the same in terms of severity. People with schizophrenia may lack family support because of the impact of their behavior on those relationships. There is no cure for schizophrenia. Treatment for schizophrenia usually involves antipsychotic medications, also called major tranquilizers or neuroleptics. These medications are more effective at controlling the positive symptoms, that hallucination, delusion, and disorganized speech and behavior, than the negative symptoms of schizophrenia. Medications used for mental illness will be discussed in the last section of this module. Behavioral interventions also play an important role in the treatment of schizophrenia. People with schizophrenia function better when they receive coping skills training in life skills such as managing finances or transportation compared to only using antipsychotic medications. Assertive Community Treatment, ACT, is a comprehensive case management approach that works very well with people with schizophrenia. In Florida, ACT is known as FACT for Florida Assertive Community Treatment. A multidisciplinary team works closely with an individual to help the person manage medical appointments, medications, housing, financial matters, and coping skills. FACT team services are provided around the clock in homes or in community settings. People with schizophrenia can benefit from structure, repetition, participating in productive daily activities, safe and secure environments, and peer support services. This concludes Module 4, Part 1A. You may go back and review the areas of diagnosis, and particularly schizophrenia, or move ahead to Part 1B, where I'll discuss the other common psychiatric disorders in detail.